and this reactive bone formation is known by the name of involucrum. Alright, so involucrum is a reactive bone formation which is a normal bone which is trying to limit the progression of this inflammatory pathology. So this is involucrum. What happens over a period of time, that if the organism continues to grow, for example, this is organism, it continues to grow, then it will create a window in this involucrum. All right, it will create a hole in this involucrum. It will create a fenestration in this involucrum, and this hole which is created in the involucrum is known by the name of cloacae. All right, so cloacae is a fenestration or a hole in the involucral wall. Now just try to see what all being written over here. Now what is involucrum? It is a reactionary bone around the granulation sequestrum and the organism. Now you already came to know about what involucrum is. Then what is cloacae? It is a fenestration or the hole in the wall of the involucrum. Now imagine when the organisms are have started moving out of this involucral wall, or that means through the cloacae, then it will lead to a creation of a passage, and this passage goes all the way up to the level of skin. All right, this passage will go all the way up to the level of skin, creating an opening in the skin, and that skin opening is known by the name of sinus. So here it will lead to the creation of a sinus. Now imagine if the patient is having, for example, increased bacterial activity. So it will lead to the formation of the abscess. Now this abscess, because it is having a tract which is made all the way up to the level of the skin, it will lead to the drainage of the abscess out of the skin through that sinus. Also, there is also a possibility that this sequestrum might also come through this sinus tract and might be drained out of the body. All right, so this is represented by a bony spicule coming out of the sinus. So what all being written over here in the sinus, that it is a clinical feature for the chronic osteomyelitis, and sequestrum, sequestrum can come out of the active sinus along with the abscesses. So this is what all are going to be the pathophysiological features for chronic osteomyelitis. Again, quickly, let's have a revision of what we have discussed. First, we have discussed about the sequestrum. You came to know that it is a dead bone which is surrounded by granulation. Second is the involucrum. So it is a normal bone which is trying to limit the expansion of this inflammatory tissue. Third is the cloacae, which is a creation of the hole in the involucral wall. Fourth is the presence of sinus, which is considered to be the only clinical feature for chronic osteomyelitis, through which the abscess can come out, through which the sequestrum can come out. All right. So these are the four histopathological features of chronic osteomyelitis. Now, as far as radiological features or radiological findings for this chronic osteomyelitis are concerned, this MRI will reveal the paprika sign. All right. So it is actually having a rim sign. All these features, the involucrum, this presence of sequestrum, granulation, it will appear like a rim, and that is the reason why it is known by the name of rim sign. Now, the management principle. Now comes the treatment, or what is the management protocol for this chronic osteomyelitis. Imagine a patient is suffering from this chronic osteomyelitis, and here we are having all the inflammatory tissues which are present inside. So this is the pathological cavity which has been created. So what is the ultimate management? Ultimate management is that you have to perform sequesterectomy by saucerization. That means you have to perform sequesterectomy. What do you mean by the term sequesterectomy? Removal of the sequestral cavity or the removal of the sequestrum. How will you remove the sequestrum? By creating a window, all right, and then you remove the sequestrum out. Now there are two types of the processes, or there are two ways by which you can perform this sequesterectomy. Sequesterectomy is essential because until and unless you don't remove the seat over which the organism is growing, you cannot control the infection. So sequesterectomy has to be performed. But there are two ways of performing this removal. One is that you create a small window and then remove everything out. All right, then you curate everything out. And the procedure B is that you create a larger window and then remove everything out. So this is procedure A, where a small window is created, while there is a procedure B where a larger defect in the bone or a larger cavity in the bone is created. All right. Now, out of the two, which one is likely to be beneficial? Is it procedure A or procedure B? So majority of you might be thinking that in procedure A, because you are creating a smaller window, because you are removing everything out through a creation of a smaller window, it is much, much better because you are creating a lesser defect in the wall of the bone. But what in reality happens? Imagine if you go with the procedure A, then in future, if there is a formation of the abscess, then because of the smaller hole that you have created, this abscess is likely to get collected inside the bone in future. But in case, or with the procedure B, in future, if there is a formation of this small amount of the abscess, it will be readily drained out of the bone because of the larger window that you have created. So the better procedure is procedure B in comparison to procedure A. All right. So this is what is important for you to remember. Next is that why is it known by the name of saucerization? You know, the procedure that you are performing is known by the name of saucerization because imagine if this is the cup. All of you know what the cup and saucer is. Now, cup is having a narrow and a deep opening, while a saucer is having a wide, shallow opening. And here, because you are opening a bone in a wide manner, in a shallower manner, you are creating a greater or a wider defect in the bone. That is why it is known by the name of saucerization. So, what is the principle of the management is sequesterectomy, which is performed by saucerization. That is the principle. Now, whether the use of graft is required, whether the use of antibiotic impregnated cement is required, whether the use of antibiotic carrier is required, all right, wax suctions are required, then fixation is required, immobilization is required. All those things are adjectives or simply the additives to the management of the chronic osteomyelitis. Because individual disease is managed individually. But the principle remains the same, that you have to perform sequesterectomy by saucerization. That is the management principle, which is common for all the conditions. Then finally, chronic osteomyelitis is an indication for amputation also. You know, in case the chronic osteomyelitis becomes resistant, which is not cured, it cannot be treated anyhow by antibiotics or by the performing the sequesterectomy, long-standing chronic osteomyelitis condition, it can result in, means it can be managed by amputation of that limb also. So chronic osteomyelitis is actually an indication for amputation. One more thing is that a long-standing chronic osteomyelitis condition can also be converted into osteosarcoma. You know, it can also be converted into osteosarcomatous disease. All right. A long-standing infection can be converted into a malignant tumor. That is osteosarcoma. Finally, the last thing which remains in case of chronic osteomyelitis is that already we have talked about, like MRI in chronic osteomyelitis is done for two purposes. One is for the identification of a rim sign, which we have already discussed about. That means condition. Second is paprika sign. Now, what is paprika sign? It is actually the presence of a healthy bone at osteomyelitic site. That means if there is a presence of a healthy bone which was previously occupied by osteomyelitic site, it is considered to be a paprika sign, which is a good prognostic indicator. Suppose you have performed a sequesterectomy, you have gone for the management of this condition, and then you are asking a patient to get this MRI done 6 weeks after the management, and in the region there is no rim sign, rather a healthy bone is present at the site which was previously occupied by sequestrum, it is a good prognostic sign. So it is a paprika sign. That means management is going in a good or a better direction. So hopefully you have understood everything related to chronic osteomyelitis. Now, in the form of the X-rays, what you will get is that there will be a presence of the sequestrum, there could be a presence of the involucrum. All right, all those features could be provided to you in the form of the X-rays, and then they can ask any question related to this particular topic.